I believe it's time now to make sure that all British Columbians and all Canadians understand that our public healthcare system is at risk. It defines who we are. We've seen that graphically over the past 12 months. Were it not for public healthcare, we wouldn't be in the envious position we are coming out of a pandemic, looking forward to a brighter, more prosperous future. But the costs of COVID-19 are not just today, they'll be for the long term. We have not any idea yet what the long-term costs will be for those who will suffer long-term symptoms from COVID-19. We do not know yet what the cost will be to catch up on the surgeries that have been delayed. Here in British Columbia, in the next 10 years, 1 in 4 British Columbians will be over 65. The impact that will have on our long-term care facilities is profound. We need to develop new programs and new policies for the 21st century. I know the federal government is receptive to these dialogues. I know the federal government is acknowledging the problem. We are here today to say to the federal government, we need to address this issue now in this federal budget so that we can plan here in British Columbia and across the country for the challenges that we all face. I want to thank the federal government for the contributions they have made over the past 12 months. They have been life-saving for businesses, for people, and for communities. But that is a one-time, short-term fix to what has always been a long-term problem. Since I joined the Council of Federation in 2017, every conference we have has focused on the health transfer. And so before COVID, we recognized the challenge. COVID has brought it into graphic light. It's stark, it's profound, and we need to take action. We're here today appealing from every corner of the country to our federal government to acknowledge that in the coming budget. If they do so, Canadians will be grateful, because this is not about governments, it's not about orders, it's not about fiscal federalism, it's about services for people. And the only way we're going to meet the expectations, the legitimately high expectations of the citizens that we serve, is by having a cost-sharing formula that's closer to 50-50 rather than 78-22.